Here. All right, so let's look at your primary reproductive organ, because that's what we are going to be looking at here. Okay, we are going to be looking at the ovary. We are going to be looking at that thing right there. Okay, there's your ovary. A lot of action occurs there, and a lot of action occurs in the uterus. All right, so those are the two kind of major things that we are going to have a discussion over. Everything else I've already created, and it's up there for you to go ahead and look at and review. We'll be able to have a lot more review instead of me just lecturing up until the very last second and then ta-ta. Okay, so please review those. I don't expect you to review them over this weekend, okay, or at least on Thursday. Friday, you'll probably have a lot of time on your hands to sit around and do nothing and review. But next week, we can start going over and reviewing some of these questions that you may have when it comes to these recordings we've already created, or I've already created. When we look at the ovaries, they are paired. You have one in each side of your body. Okay. They are lateral to the uterus. Okay. And they can vary during the course of your menstrual cycle. Okay. As they kind of increase in size a little bit as they get ready to be spitting out of the egg. But what is the ovary? This is the site where we get the egg production, or oocyte. And this is going to be the hormone, or this is going to be the hormone. This is going to be the structure that creates estrogens, progesterones, all the fun sex hormones that make you the woman that you are today. So here's where that ovary kind of sits. Again, lateral to the uterus. Right, you can see it right there, lateral to the uterus. Right, there's the ovary. There's the uterus. Oh, excuse me. Okay. We have a number of various different ligaments that help to hold this thing in proper position. And by this, I mean the ovary. Okay. We have ones that hold the uterus in position. And we have a number of hormones. Oh my gosh, I am losing my mind. We have a number of ligaments that help to hold the ovary in place. The ovary is held in place by three different ligaments. They are the broad ligament, and the broad ligament, guys, is just a sheet of connective tissue right there. It actually drapes over the ovary. It drapes over the fallopian tube. It drapes over the uterus. It'll help kind of hold everything together within this pelvic cavity. Okay. So not only is it helping to anchor the ovary, it's the oviduct, the uterus. The two major ligaments that help to hold this thing in shape in space, I am losing my mind this morning, is the ovarian ligament and the suspensory ligament. And the ovarian ligament, yeah, there it is right there. The ovarian ligament extends from the uterus laterally, holding that ovary in close proximity to it. The other ligament you have is right here. It runs from the lateral wall of the pelvic cavity towards the ovary. It's important because of what it carries in it. The ovarian artery, the ovarian vein are carried to the ovary via this suspensory ligament. Okay. Those are the two major ligaments involved in helping to hold this ovary in proper position. When we look at the ovary in cross-section, There it is. Not much to it, really. It has an outer cortex and an inner medulla. The inner medulla is there for really one reason, and that's for the vessels, nerves to come on in from that suspensory ligament and supply the ovary with sustenance and remove all the waste products and provide nervous innervation. We have a germinal epithelium. Germinal epithelium is simple cuboidal in nature. And this is where we're going to have the maturation of the egg occurring. We have a tunica albuginea, deep to the germinal epithelium, just kind of help giving some shape. But let's see where all the fun stuff is. This is where all the fun stuff is. Here is all the various different structures that we are going to be, well, that you are going to be forming inside your little bitty ovary. We have a number of different oocytes. We have a number of various different follicular cells present here. These follicular cells are going to help support the egg. And I keep saying egg just because it's easier, okay? The oocyte, if I need to be specific. We have the primary oocyte, a secondary oocyte. There are a number of various different oocytes, as you can kind of see from the picture. And then we have this scar towards the end, like an empty wrapper. All of these structures that you see on here are going to be very, very, very important in the development of not only estrogens, but of a viable egg for which we can come in and fertilize. So when we look at the ovaries, okay, this is where we're going to start right here. This is the starting spot. Start. Okay. That name will look like a word. Start. S-T-A-R-T. This is where we're going to start right here. With that primordial follicle. This is the beginning. Okay. This is what we are for. This is what you are forming in utero. A number of these cells that will differentiate into a egg, differentiate into an oocyte. They're very rudimentary in structure, as you can kind of see from this picture here. Okay, there's primordial follicle. Again, nothing really fancy about it. In utero, you guys produce a huge amount of these beginning cells. 1.5 million. I'm not going to ask you the number. I'm just trying to impress upon you what you guys do. You guys will produce a number of these primordial cells in utero. You stop them during prophase 1. And there it sits. Okay. You have about 1.5 million present at birth. That's crazy. You should be Miss Fertile Myrtle, right? Or something like that. But we're going to see there is some attrition that occurs. You reabsorb a number of these things over the course of your early development, even prior to hitting that puberty thing. From the primordial follicle, we develop into the primary follicle. We contain a primary oocyte, a primary egg. And now we start getting, because here, I didn't really get into it. It's just, I mean, there's a big kind of follicle here, a big egg with some just flat cells around it, okay? Nothing too fancy. Nothing too fancy at all. But here, we start having this maturation event. So now this primary oocyte, that was still here, okay? Now it's going to be surrounded by more cuboid-shaped cells, and I don't really care about that. I care about what we call these things. This primary oocyte is now going to be surrounded by these cells referred to as granulosa cells. Granulosa cells are important because of what they do. They help secrete estrogens. As these cells start to mature, they start to produce it. As they get bigger, they produce more and more and more of it. It's obviously the presence of this estrogen that stimulates puberty. A number of changes within the female body, right? Not only of the uterine lining, but a bunch of fun changes that are happening all over the body. You start to see the development of a zone called a zona pellucida. Okay. And that's immediately surrounding the oocyte. Okay. It's not. What is the zona pellucida? I guess if you have to say something that's there, it contains glycoproteins. 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 All right. This is going to help sustain the egg. Okay. It gives it some nutrients, right? That's what it's going to do. And as you can see, it's just a very thin layer. Just a very thin layer. This primary follicle is going to start developing right around puberty. Okay, as estrogen levels start to rise up. We go from the primary follicle to the secondary follicle. And from the picture, you can see this is a drastic change from this primary follicle right here. Drastic change. We have a heck of a lot more granulosa cells. So if we have more granulosa cells, what does that tell you? We're going to have a secretion of a heck of a lot more estrogen. Okay? A heck of a lot more estrogens. What's estrogen going to do? Well, it's going to do a couple different things, as we'll see, but it's going to cause an increase in the development of the oocyte, and it's going to cause an increase in the development of the uterus. As you can see, there are multiple layers there. I don't really care. Granulosa cells increase in numbers. That's all you got to say. As you can see, the zona pellucida is increased in size. More glycoproteins. Again, this egg is developing. You can also see we get the development of thecal cells surrounding this secondary follicle. This is also going to help with secretion of estrogens to further the development of this secondary follicle. The follicle continues to develop. How does it continue to develop? It continues to develop because of all of the granulosa cells. Oh my God, they're increasing in number still. As these granulosa cells continue to increase in numbers, they continue to produce a estrogen amount of substance. A lot of estrogen get produced by these granulosa cells. That helps to further the increase in size and the development of this egg. You can see we have the zona pellucida. Yep, still there. Okay. Thecal cells, still there. But we have so many granulosa cells producing so much estrogens that they start to fill up this space. That space is the antrum. So this developing follicle is being bathed in estrogens. And this is going to help the maturation of this follicle. As you can see, just around, just right to the outside of the developing follicle, the developing egg here, we also start to have a development of what's called a corona radiata. Just a number of cells that are going to help with the final development and maturation of this follicle. At around day 14, that follicle that has been developing since the primary follicle took shape is called the Griffinian follicle. And the Griffinian follicle is the mature follicle. I think this book refers it to as the mature follicle, so that's how I will do it. Griffinian is an old name. The mature follicle contains the oocyte that will be spit out. And that's literally how it happens. We have a huge fluid-filled antrum bathing this developing oocyte in estrogens. As this fluid is building up inside this developing follicle, it's going to help push the now mature egg towards the periphery of the ovary. And just before this thing gets spit out during ovulation, again, it's been developing. So it picked up from prophase 1 where it was paused and stopped during in utero development. And it's gone through meiosis 1. And it actually started meiosis 2. And this developing egg paused at metaphase 2, the second phase of metaphase. Why? Because it may not get fertilized. If fertilization is to happen, if the sperm does make it all the way to home base here, then the egg will finish off the second phase of meiosis, implant the uterus, and hopefully stick around there for the entire pregnancy. Okay. By the time you reach puberty, you only have a few 100,000 of these, a little over 1 million of them. And of those few 100,000, a couple 100,000, something like that remain from in utero development, only a handful of those are ovulated, and usually it's only 1 per month. After the egg is released, you have what's called a corpus luteum. Corpus luteum is a remnant that exists. It's like an open wound on the surface of the ovary. The egg inside, the oocyte, has been released, and it's just all those thecal cells, granulosa cells that are there that remain. The corpus luteum is very important. It is very important for one major thing, and that one major thing is in bold there. There it is. Okay. The corpus luteum is going to be very important in the production of a sex hormone called progesterone. Progesterone is going to help to further uterus development. What kind of development? We'll talk about that when we get to the uterus, but it helps to thicken up the lining. Because if this thing is fertilized, this oocyte is fertilized, then the uterus is going to be maintaining this embryo until we can get the placenta formed, and then enter into fetal development. What if there is no fertilization? Corpus luteum becomes a white scar. And that's the corpus albicans. Corpus albicans doesn't do jack squat, doesn't secrete anything, doesn't do anything. So corpus luteum goes away. Progesterone levels plummet. And then that coincides with you guys having a menstrual cycle. The reabsorption of the vast majority of these ovaries, guys, is referred to as atresia. And again, there's the number. I'm not going to ask the number. Okay. I'm not going to ask the number. But a number of these ovaries are going to be reabsorbed. These primordial follicles are going to be absorbed. I always find that crazy. I always find that fascinating. I have no idea why that happens. I've never actually looked it up to see if anybody gave a reason as to why. But of these 400,000 that remain, maybe a couple hundred, maybe 100 or so will be released or will remain. But you guys have a finite number. You reabsorb and reabsorb and reabsorb them over the course of your life, over the course of development. which is vastly different from a male. Male, as long as he has testosterone, he gets sperm, right? And that's really all you need. Now, I'm not saying they'll be an effective swimmer at age 80, but I wouldn't want to be 80 having a child. So, but being an effective swimmer is different from producing. And that's really the major difference between a female and a male. We can produce as long as we have testosterone. Where women, you have a finite number, and you slowly whittle those away over the course of your time. Yeah, you're the only one. I don't know what's going on. Somebody was having some issues earlier.